I'm Nicole, and I'm a registered nurse with Agrace. In the next few minutes, I'd like to talk about what you might expect when someone takes medications called narcotics to relieve pain or other troubling symptoms. I'll also talk about myths you may have heard about medicines like these and what you should know before taking them. But first, when we talk about narcotics, which are also called opioids, which medications are we talking about? The most common is morphine, but there are others like fentanyl, hydromorphone, oxycodone, and hydrocodone. You might have heard that many patients take narcotics, like morphine, for example, and that is true. Agrace's nurses, nurse practitioners, and doctors often give these medicines to our patients to help relieve pain and to make breathing easier. These medicines can be a good choice for many reasons. They are quickly available and they're strong enough to help with moderate or severe pain. The dose of most narcotics can be adjusted or increased if pain gets worse over time, and hospice providers do get special training about these medicines so we can help make sure that they are taken safely. Along with giving you relief from pain or breathing difficulties, narcotic medications may also cause side effects, and we want you to be aware of what those may be. Knowing the common side effects of your medicine can help you tell the difference between a reaction that's common and expected and one that may be more serious, like an allergy. Knowing about side effects can also help you understand how quickly they might go away and what you might need to do to feel better. Fortunately, most common side effects of narcotics do go away within a week of starting the medication. Let's take nausea, for example. Nausea is that queasy feeling of constantly having an upset stomach. It's a common and expected side effect that should go away quickly. We even have anti-nausea medications that you can take to get through those first few days until the nausea wears off. One very common narcotic side effect that does not go away is constipation. That is why your Agrace team will ask about your bowel movements a lot, way more than you might ever want to talk about going to the bathroom. Whenever you are taking a narcotic medicine, we also have you take a medicine for your bowels like a stool softener, and we ask you about it often to make sure that it's helping. We find that constipation and nausea are two of the most common narcotic side effects, but here is a list of others that you'll want to be aware of. Again, most of these should go away within a few days of starting the medication as your body gets used to it. The exception here is constipation. You will find more information about common narcotic side effects and helpful treatments for those in the patient support section of your Patient Family Care Handbook, which you also might refer to as your Agrace binder. Let's talk about addiction. It's easy to understand why some people are worried about becoming addicted to narcotic medicines like morphine. Addiction means that someone has an uncontrollable craving for the medicine even when they aren't in pain because they like the way it makes them feel. When you're taking medication as a hospice patient, you're taking it because something is causing real pain or breathing trouble. Studies show that problems with addiction are actually lower in patients with serious illnesses. Some hospice patients don't want to ask for more pain medicines when they really need it because they're afraid that they're addicted or that they're worried what other people might think of them. What more likely is happening is that they're becoming accustomed to the medicine and they might need more of their pain medicine because it isn't as effective as it used to be. This is normal and expected for people who take these medicines regularly. Sometimes we also hear patients or their families say that taking these medicines means that they will die soon. Please know that many people stay on these medications for months or even years while they get relief from their pain or other symptoms. Sometimes these patients are even able to find comfort in their final days without needing any narcotics. We believe that it is okay to take a medication that will make it easier for you to have a better quality of life, because no one can know for certain how long that time will be. Please remember to call Agrace or let your team know if your pain gets worse. you're having side effects that need treatment, such as constipation or nausea, or you have questions about the medications that you are taking. We are here to help you, so please be sure to let your team know if you need anything at all. Also, please remember that you can refer to this handbook to find answers to many of the questions that you might have about the common issues that arise when someone is very ill or near end of life. Thank you so much for watching. We are honored that you have chosen Agrace.